Afternoon. We're really excited to have everyone here again today for the third of 4 sessions on skills for psychological recovery. I'm Robert Stiles. I'm the program director for the Kansas Disaster Outreach Program, of which this is a part, as well as the Telehealth Rocks program. Really excited to have everyone. I know the first 2 sessions have gone extremely well, and excited about today's session. So I wanted to hand off to Joa, who will get us started today. Joe is here. Have we seen Joe?
I don't know that he's had a chance to join yet. Can we hand it off to Melissa or Aaron?
Yeah, Aaron, do you want to get us started?
I can get us started. Hi, everybody. So thank you for making it to our third of the Skills for Psychological Recovery series. We've kind of got our usual suspects here today to lead us through some didactic elements. Today we've prepared a role play for you, so that should be fun to look forward to, in addition to our breakout rooms at the end. So if you could move to the next slide. As usual, we still don't have anything to disclose. And again, our very favorite part, or at least my favorite part of this entire series, both the PFA and SPR trainings, is that the information needed to learn this information is freely available online. And I want to go ahead and put in a reminder that there is a free online training course in Skills for Psychological Recovery through the National Child Traumatic Stress Network. In a minute, when I'm not speaking, I'll try to find that link and put it up there. But for those of you who would like to dig into this a little bit more, or who have colleagues that you think might be interested in this training, there is the free online training available that corresponds to the manual. Next slide, please. And again, what we are presenting, at least to our knowledge, is best practice in the field of early responses post-trauma and disaster. Next slide. And I apologize because this slide might not have been updated, but for our fourth and final session coming up, we are going to be digging into the skills that we haven't yet dug into. One of those, for example, being positive activity scheduling. So I would encourage you to take a look at that before our fourth and final session. And as always, we will send you today's recording, the chat log, and we have a word cloud planned for the end that we'll be sending to you as well. But to introduce today we're going to really focus the entire time on this skill, managing reactions. This is a skill that is fairly in-depth in nature, so we want to make sure that we spend a lot of time and give you all a lot of time to think about how you might apply some of these skills, both when working with adults, but particularly what adaptations or considerations, really, not necessarily adaptations, we want to make when children and families are the focus. Next slide. So managing reactions really involves skills that might be helpful for survivors who identify pretty distressing physical or emotional reactions in response to what has happened to them. So remember, we have a lot of different skills that we've been talking about during this training. And SPR is very skills focused, right? It differs from psychotherapy. We are really trying to give people skills that they can immediately use. You as an SPR provider are a cross between a teacher and a coach, right? That's your role. It's not therapist. Managing reactions, like some of the other skills, can kind of muddy the waters a little bit in the sense that we really are trying to help people understand ways that their physical and emotional functioning may have changed since the disaster or trauma or the bad thing happened to them. so that they can understand that connection between what happened, the event, right? And when we've talked about definitions of trauma, we've talked about how the event matters, how the person's perception of the event matters, and how the effect on their life also matters in terms of defining a trauma. So we're really trying to help people make a connection between what happened and now any changes that they're noticing in their lives. And then we want to provide them with strategies that they can begin using right away, whether or not they meet criteria for any mental health problem, right? So we're still in this 2 to 6 weeks post-disaster. You really can't even diagnose something like post-traumatic stress disorder within this window, right? We're still in this window where basically all reactions are pretty expected, typical, and normative, but it doesn't mean they're not distressing. And it also doesn't mean that when those reactions get put into place that they couldn't later lead to a mental health diagnosis, right? So we are wanting to help people connect between what happened to them, changes in their functioning, and then what they might do right now. So that's really what this skill is all about. Some parts might feel a little bit like what you might do as a therapist. And for those of you with mental health training, I think you'll have that broader knowledge to draw upon, but there really is an important distinction. Next slide. And finally, just to kind of ground us in what we're going to be covering today. So what we see, what can be normal in this immediate aftermath are upsetting reactions when people are reminded of what happened. Maybe it was a death, maybe it was a car crash. And these reactions can, as early as 2 to 6 weeks post, begin interfering with important life domains, relationships, daily functioning, overall well-being. And learning to manage these can really improve self-efficacy, can put control back in the hands of the survivor, can help improve their confidence, and can help get rid of any kind of maladaptive or not so useful coping that they may have engaged in since this occurred. So with that said, I think that's our last introductory slide, and I'm going to let Dr. Maris talk with you all a little bit about what some of these common reactions are and what to look for as we start out for today.
Awesome. Thanks, Erin. And hello, everyone. Welcome back. So I'm really excited to be able to talk to you all today about these, what we call distressing reactions. So something has happened and now a person is having a response to that, so child or adult. And one of the reasons I am really glad to be able to talk about this is because this is one of the things that I think that we can do as humans to help other humans deal with really difficult things. And that is around the area of psychoeducation. And so talking about what could happen or what the response could be, normalizing that often happens, talking about ways to manage it, and also reassuring that just because it's happening now doesn't mean it's going to last forever. And for me, when I kind of think about what this all translates as when we put it together is really kind of this idea of connecting the dots. And so, if someone doesn't know about, distressing reactions that could happen after a disaster, then they may experience things or even act in ways that are new and different, that are concerning to themselves or people around them. And if we don't know what is happening to us or happening within us, then it can be confusing and scary. And the way I often think about this is that I think sometimes when these things happen and we don't talk about it because of the stigma around mental health or other reasons, I think a lot of times it can leave a person feeling broken. And what I always say is that we don't have broken people. We don't have broken children or broken adults. We have friends who are hurting. And so this idea of psychoeducation as one important step in helping people with recovery. This can also be a very important component in terms of working with parents and guardians and other adults around young people who have experienced something difficult, again, to provide that education around what kinds of reactions they may see or that they should or could be looking for, so that again, that they can be aware of that, but then also can be having conversation, hopefully with that young person, making sure that they also understand what is happening in their body. Our reaction to really challenging situations is biological in nature. It is something that happens because our brains want to keep us safe. So just knowing that can be really, really powerful in understanding what's going on with us, with ourselves, and how to move forward. If we can go to the next slide, Christy. So in terms of some distressing reactions, and I'm just going to walk through these fairly quickly, but did want to cover them somewhat. So the first sort of kind of area that we think of is post-traumatic stress reactions. And the SPR manual does a really lovely job outlining these in handouts that are at the very end of the manual in the appendix. And that's what you see on the right of your screen here is directly pulled from the manual. So this is the kind of information that you could use and refer to yourself, or that absolutely to share with other people. Again, this may seem obvious to you, or maybe not, but if it does, everybody doesn't know this. Mental health literacy is still a real challenge in our communities. And so it's important that we are talking about these things so that people know what might happen and what this might look like. So post-traumatic kinds of reactions, absolutely re-experiencing. So this is kind of this idea of intrusive memories that are kind of popping up. Certainly avoidance. So either avoiding physically a space or avoiding a topic, kind of going out of a person going out of their way to not be close to that content or that space. This idea of numbing, so kind of an internal avoidance, if you will. So this might be pursued through kind of different kinds of things to distract ourselves. The Zoom or the doom scrolling that I think a lot of us sometimes do on our phones, just anything that can help us get out of the situation and kind of numb ourselves so that we're not having those feelings, difficult feelings that we're not thinking. Certainly using drugs or alcohol or other substances to try to kind of just get rid of whatever that feeling is that's challenging to have and to feel. And then certainly the activation. So feeling really jumpy, kind of irritable, sort of disconnected or dysregulated, that things aren't really making sense, but just having a whole lot of energy. And certainly with this activation component becomes not paranoia, but certainly kind of what we would consider to be perhaps hypervigilance. So being very aware of what's happening, reacting and kind of attending to loud noises or new people, doors opening, things like that might be a reaction that happens following a stressful situation. Go to the next slide, Christy. And then also kind of some other buckets here of distressing reactions. So one that I wanted to highlight, particularly when it comes to young people, but I think this applies to all humans, is anger and irritability. So it's very common after something difficult happens to respond with anger or to be irritated for any number of reasons. Something difficult has happened, perhaps feelings of, this wasn't fair, why did this happen to me? Lots of kinds of patterns of thinking that might result in anger or irritability. I also think particularly with kids, but again, with all people, that it's helpful to remember that anger is often masking a whole bunch of other stuff. And so you all may have seen something similar to this idea, this anger iceberg, that oftentimes with anger, there's some other emotion behind it. But anger is either easier or quicker to come to the surface. And so what we often hear and see is the anger. Someone once said, when it comes to anger, don't be an ass. So ASS, with this idea that anger is masking sad and scared. And so when we think about someone and their responses and their behaviors, when we see them and they're angry, our natural response is to get defensive or scared, right? We respond to big voices and big people as they're getting bigger with their behaviors. our bodies respond differently when we think about that behavior as them being actually sad or scared. Our body calms down, our heart rate lowers. We physically respond differently. So kind of remembering that idea that anger is often masking something else. And irritability, of course, and anger, of course, can also be very connected to sleep difficulties, which are also common and common reactions following a difficult period in some sort of disaster or trauma. So sleep difficulties in terms of anything that you might expect that is different than what it was like before. So either difficulty falling asleep and staying asleep, sleeping too much, sleeping at different times. And those sleep difficulties, again, are very, very common. I sometimes think about our brains after something difficult has happened. And part of what our brains are doing our brain is actually physically trying to also recover and make sense of things. And that is exhausting work, right? And so sometimes people sleep a lot more than usual or have difficulty sleeping, perhaps because of nightmares or bad dreams. I also wanted to talk a little bit about reactions to chronic stress. We talked in our very first presentation about how it's important for us to consider disaster and trauma within this broader context of our lived experience. And for a lot of people, day-to-day life is pretty challenging, and it's stressful, and it's chronically stressful. And so that is sort of the baseline sort of status quo. And then when something difficult happens, it kind of adds additional stress and challenges to sort of that homeostasis. But certainly in terms of reactions to chronic stress, feeling exhausted, difficulty concentrating, any of those things that you might think of after any of us have had a long, hard period of kind of sustained attention that's been really challenging. Depressed mood is a common reaction, it's distressing reaction. Again, what we're looking for here is kind of a difference between what a person was like before and then after. But depressed mood might be seen in terms of just general lethargy. So someone's body is moving more slowly, sleeping a lot, even sometimes the way a person is speaking can slow down if they are feeling depressed. And then also this idea of post-disaster fears. Very, very common after something difficult has happened, particularly among children, but really, again, among everyone, to have fears that are directly associated with what happened. And part of that is our brain trying to keep us safe, right? Something bad happened and our body is trying to learn from that so that it doesn't happen again. And so what we might see is, again, some of that avoidance, constant thinking about it, trying to problem solve, really perseverating on that fear. And that's very, very common in terms of a disaster or trauma reaction. If we can go to the next slide, Christy. So kind of coming back in terms of, again, something that we touched on during our very first session here with SPR is this idea of, so there's these reactions. You can see that several of them might be connected, right? So if I'm not sleeping well, I might be very irritated. That irritability might lead to more conflict interpersonally, which then leads to anger. And so they're all connected, right? But as we look at some of these distressing reactions, the question would be, well, how do I know? How do I know if this is a reaction to a bad thing that happened, or if it's something else? How distressful is too distressful, right? How distressed is too distressed? And so we talked about this in the very first session in terms of when a mental health challenge or issue, and we all have mental health challenges or issues all the time, when that kind of crosses over this level where we need to be thinking about some sort of actual intervention, so something and that we need to do something about it. And again, thinking about that idea of frequency, intensity, or duration. So the challenges of sleeping, for example, if a person is having a hard time falling asleep one night, that's different than not being able to sleep for the last week straight. So kind of frequency, how often is it happening? How long is the person unable to sleep? Is it just taking longer to fall asleep, or is there a real inability to sleep at night? And then duration, how long has this happened? So something that's happened, again, for a couple days versus multiple weeks. And we kind of think about all three of these at the same time. Sometimes one time is too often, right? Or sometimes something is so intense that intensity is too much, even if it just happens that once. And sometimes duration, it doesn't really matter because it's so intense, regardless of frequency. So we kind of put them all together. But ultimately, what we want to keep our eye on, just in general, but also when we think about a post-disaster response, is how that reaction is impacting functioning. And this is, again, really where I think SPR can be a great tool for communities and for you all here, because when using it in your local context, you will have the best knowledge and awareness of what things were like before. And that's a really great touch point in terms of how we're trying to understand what's happening after. We're looking for changes and differences and disruptions in someone's typical behavior. And we're acknowledging that things might have been challenging before, which makes it even more complicated now. But we're looking at impact on functioning, a person's ability to take care of themselves, hygiene, kind of basic self-care, eating regularly, eating healthy, exercising, sleeping, their relationships, so how they're interacting with other people that they care about, certainly the ability to function either in a school setting or work setting or a community setting, but really how is it impacting a person's day-to-day life? And that's really going to be the answer to the question, how distressed is too distressed? And also the way the person themselves defines it. We might look at a reaction and think, well, that's not really that big of a deal, but it might be a really big deal for that person. So again, that's a kind of a reminder for us to always center the person we're working with in this conversation and in this work, so that we can really understand their perspective and their lived experience. Because again, when it comes to trauma, disasters, it really is that individual experience of that event that leads to these different kinds of adverse effects. And again, psychoeducation being a really, really important part, not just of SBR, but just in general, when we're having these conversations about mental health and challenging times, that we talk about these reactions, we normalize them, and make sure that folks are aware of them, so that when they do start to impact functioning, that we can start to respond in ways that make sense and are helpful. So with that, I'm going to hand it back, I think, to Erin. Yep. Okay. Who's going to talk a little bit more kind of about what we do with this now that we are understanding what the reactions might be, kind of what is the next step.
Yes, thank you for that context. I think, it's so important to remember that part of what's hard about responding following a trauma or a loss or a disaster is that everybody's experience and reaction to it is going to be vastly different. So while we talk about these common reactions, also really digging in and remembering that probably if we were really using SPR before we're at this place of trying to help someone manage reactions, we did a lot of good information gathering at the beginning to help us really be aware of the contextual factors going on. Next slide. So some of this kind of repeats what Dr. Maris was discussing, but we'll kind of continue to build on it as well. So it can actually be pretty hard for you as the SPR provider and for the disaster or trauma survivor to pinpoint what distressing reactions they're having. So remember, and we've talked about this thread in a lot of these trainings, people who are impacted by trauma and disaster they've really kind of had a shakeup in terms of even their biological activity, right? They've really had to mount a stress response proportionate with the stressor experienced from their environment. And people who have a history of previous traumas, of prior traumas, their system in some ways is already pretty sensitized, meaning that they were probably able to mount a really full-blown reaction to help them survive the initial impact. Right? None of this is bad. In fact, all of this is amazing. It's really amazing that our bodies, our very biology, has adapted to help us find solutions to extreme stressors, to give us the ability to have almost unhuman-like strength when we need it, when we need it to survive. But that can be a huge jolt to not only our physical, but our psychological systems. And so when you are working with somebody 2 to 6 weeks post disaster, they are probably still having trouble, keeping a train of thought, remembering really well what happened to them yesterday, because who cares about that? I'm still kind of trying to survive, right? And get through a given moment. So we definitely don't want to expect when we're having these, 30 to 40-minute sessions with children, families, adults, that they're going to be ready to sit down and like have a business meeting with us. Right. And have their pen and paper out and, oh, yes, I'm having that too. Right. This is going to look a lot different. You're going to have to be creative and compassionate and connected and quite honestly, a scientist a lot of the time, who is really trying to connect with someone and figure out what are the distressing reactions that you're having. How would we even know the ways in which your functioning has changed? So just keeping in mind that, sit down, direct conversations with people could be challenging, I think will guide a lot of your work in terms of this managing reactions section. So as Dr. Maris said, we really want to provide psychoeducation to people, even people who we might know are, a doctor or a therapist themselves. It can be really meaningful to have someone look at you and say, this is true for you right now, right? You might have the book knowledge around all of this, but guess what? This is what you're going through, and it's okay because of what you've experienced. And I bring up psychoeducation again here because I think that psychoeducation can be a very good way to help people even understand, elicit, be able to verbalize or identify for themselves the reactions that they're in fact having. I don't think you'll have a lot of great luck just sitting people down and saying, what kind of reactions have you been having since this happened, right? They're going to need a template, a memory primer, examples, probably before they're really able to connect, like, oh my gosh, that has totally been happening to me. And I didn't really even think it was connected to this thing that happened maybe a month ago now. I also think that, especially if this isn't the first time that you've met with someone, reviewing what they shared and what you all together prioritize during information gathering during that phase could be really beneficial. Again, this is somebody that is probably kind of barely getting by day to day right now. And we might even consider that to be a good and high level of functioning for this individual right now. So really reorienting to, the first time we met, it was just 2 weeks after this happened to you. And this is what we talked about. These are some things that you said you experienced. These were some things you said you needed help with, right? To bring everybody back together onto the same page. I also think that instead of, asking really pointed questions like what types of distressing reactions, and you probably wouldn't want to say distressing, right? But what kind of reactions have you been having since? Ask them really broad questions. How's this week gone for you? Tell me what today was like. What was last night like? What have you noticed, dinner has been like? If they have a family that they eat dinner with, or, how are the afternoons going for you, right? Just kind of conversationally asking them about their life right now. If they work, how's work going? If they're in school, have you been back to class? Or if their kids are in school, have your kids been to school? And getting the information that you can through those questions that might be easier for them to answer. Hopefully it can be a lot easier for somebody to just describe, what yesterday was like for them. I think it can also be helpful to, ask people what has changed in your life. Has anything changed? Have you stopped going to work? Have you stopped going to class? Have you had a lot of supports available to you that you didn't expect, right? And we've talked about the power of social support, but in some people, depending on their culture or their past, that can even feel burdensome, right? So what, oh my gosh, everybody's doing all this for me and I haven't been able to help them, right? If they're feeling that way or having guilt, it's really important to know what's different, what has changed, what's returned to quote normal. And kind of during this conversation, similar to providing psychoeducation about typical reactions, we are still intersecting and encountering people really early in their post-disaster journey. And so you might even find ways during this conversation to kind of be peppering in things that maybe they haven't experienced it, but it still could happen and it would still be a very normal and predictable and expected thing to occur, right? Some people will say that there are kind of different phases of reactions when they've lost a loved one or when something bad has happened, starting with kind of like a numbing and shock phase where they're really not thinking about things and moving toward a phase where they're much more actively thinking about things. And everybody moves through those phases or, stages at different times. Next slide. So I also want to talk about how we might think about this if we're working with children. So when I talk with children, I try to be very, very careful that I'm not using words that would insinuate to them that things are worse right now than they expected or than they actually are. Right. So we've talked about this. We don't say things like after that horrifying accident, right? Or after that terrible thing happened to you. We would just be much more factual. Some people after they've been in a car crash have headaches, right? We would state the thing that happened to them. And that can actually promote a sense of calming, which we've talked about as being important for someone to actually be able to name instead of dancing around the thing that happened to them to show this isn't so big that we can't talk about it. But we're also not going to talk about it in terms that make it seem like something that can't be managed or handled or controlled. So when I provide psychoeducation to kids, sometimes I'll try to say, sometimes after a tornado, some kids look around and kind of the world doesn't look or feel the same to them. Maybe the world used to be filled with bright colors when they looked out into the world, and now the colors are kind of all gray, right? I'll try to use some imagery to help bring to life different reactions that some people could have to see if that elicits naturally any response from the kid about, yeah, you know what, that didn't happen to me, but I've definitely noticed that I don't really want to see my friends as much as I used to, right? You never know what that will kind of make them think of that they might be willing to share. Again, same as with your work with adults, you might really want to move from broad to specific. Some kids say they just feel differently after that happens. Some kids might struggle to sleep. Some kids might have a different feeling in their stomach than they used to have, right? And naming some of those things and allowing the child opportunity to begin jumping in. I also like to use nonverbal or at least less verbal modalities when kind of going through this psychoeducation / helping someone identify distressing reactions process. So I might hand a child a drawing of, kind of like a cartoon person and hand them a bunch of crayons and say, draw the parts of this person's body that are, color in the parts of this person's body that really might not feel good after they had to evacuate their home during a flood. Right? Which parts of that person's body? And then, maybe if they color in the hands, right? And they're like, ooh, those hands don't feel good. You kind of say, okay, is that other people or is that you? Right? And it kind of provides a bridge for you to be able to talk about these things. I already gave this example a little bit, but using colors instead of feeling words. Different families and school systems and cultures have kind of different kind of normative levels at which they talk in feelings terms, and so not every kid is going to be comfortable or used to talking about anger. And my kid has a mom who's a psychologist, and I'm sure that comes with pros and cons. And even just today, when I was asking her how she felt about something, she was like, "Mom, I don't actually like talking to you about my feelings. It makes me feel weird." I'm like, "Ooh, but we're talking about it, aren't we?" Right? But you want to be respectful that when you throw out something like, "Ooh, let's talk about how frustrated you might feel," that could be a really novel task, or maybe a task that people have presumed is not okay to engage in. So we want to allow a lot of different ways of expression. So talking in terms of colors, I've even had some luck with kids talking about energy levels. Does that bring your energy up, or does it bring it down, or does it leave it the same? And for some reason, and kids who really don't like it when I attach a feeling word and say, "Does that make you more sad or less sad?" They'll talk about energy all day long, right? So allow yourself just to be really creative when you're working in this space. I also think sitting parallel to a kid instead of face to face can help, because then they kind of don't feel that added pressure to perform or to give a right or correct answer, because we all know there isn't a right or correct answer. And I also think using motion and sensory tools when you can. Can you be engaging in this process while you're taking a walk with a child? Is it actually important that you be seated in some way for this? Can you be throwing a ball back and forth? Can you be playing with some of that really awesome kinetic sand that I wish would have been available when I was a young child? Although those of you who are familiar with kinetic sand, it can really get stuck in the carpet. So there are some cons to it, but right, maybe in this context, it could be a really great tool. We've talked in previous webinars about how, our sensory system is the first system in our body that receives any information from the external world, telling us and giving us signs as to whether or not we are safe. And the sensory system is really, really engaged during a traumatic event and following a traumatic event, because after something bad has happened, we're kind of on alert to like, okay, I really do need to be paying attention to the sights and sounds around me to know if I'm safe. And so that's why a lot of people will say that engaging the sensory system, smells, calming and pleasant sights and sounds in the aftermath of a trauma can be really calming, and might be actually a good fast track to helping people understand, I really am safe. I'm kind of in nature right now, and there are some calming sights and sounds around me. Maybe now would be an okay time to open up and share with someone about this really weird experience I've been having ever since the trauma happened to me. So really keep in mind the biological and emotional state of the person that you're working with, and allow that to guide the way that you dig into the use of this skill of helping people identify and then ultimately manage reactions. Next slide. So quick provider alert here is that some things will be shared with you that you probably want to just do something about pretty quickly. If people are having really immediate negative emotions, they're sharing that they're highly depressed, right? Cannot get out of bed, having thoughts of suicide, self-harm. They are drinking massive amounts of alcohol. They feel like they are the reason this bad thing happened, and they're really not able to engage in any conversation otherwise. Right? We're going to be pretty quickly trying to get them connected with a higher level of care. And also, we talk about the connection between our biological and psychological selves, but sometimes when people report biological symptoms, it could be a physical health problem that's either maybe exacerbated by or not even related to the trauma that happened. Right? So just being careful that we don't kind of step outside our scope of practice or our bounds and just assume that any physical symptom someone reports to us is just related to their reaction to what happened, and it will get better as they get more skills and as time passes. Next slide. So what I want to do really quickly, I think I have enough time. I can't remember what our timeline was. Somebody can chat me up in the chat if I'm running way over or something. But I want to briefly teach this skill called anchor breathing. So part of this managing reaction skill is that we want to help people recognize exactly what they're experiencing in relation to what happened, but then we want to start helping them make a plan for what to do about that. And Dr. Williams is really going to dig into that. But sometimes, even before you start helping someone make a plan, you want to have them in an emotional state in which they can even start to make a plan with you. And so sometimes breathing or other calming or regulating activities can help get you there. An activity that I've really had a lot of luck with lately with kids that I work with is called anchor breathing. I learned it. I did this therapeutic yoga certification for kids through the Little Flower Yoga organization up in New York City. And this is one of my favorite strategies that we learned. So often I think when we see anchors depicted in the media, they're almost cartoonish and they're cute, right? And they're like, oh, I can make a cute looking tattoo out of that, or put an anchor on a throw or something. Won't that look great? But the reality is, anchors are really, really huge. They're really heavy and they're really sturdy. And the job of an anchor is to keep a huge ship grounded, moored, when the seas around it are completely stormy, when they're completely rough and there is a risk of the ship literally capsizing, right? So anchors are pretty massive and amazing things. And so when I describe this anchor breathing technique to kids, I spend some time asking them, do you know what an anchor is? Do you know what an anchor does? And usually most kids, especially if they're kind of 6, 7, 8 and older, are going to have a sense of what an anchor does, and they can kind of call that imagery to mind. And then I'll really talk with them about how anchors have a really important job. And I'll ask them, have you ever seen a movie or a show or an image where there was a ship that was at sea and it was rocking? And usually they'll nod and then they'll say yes. And I'll kind of ask them, has there ever been a time that you've felt like a ship at sea? Not looking for an answer, a ship in a stormy sea. I'll tell them, you don't have to tell me, but have you ever felt like that ship? And I tell you what, every time I've done this, I get, right, like the big heavy nod. And I'll spend some time calling that imagery to mind. And then I'll remind them that when ships find themselves in these stormy seas, all ships have an anchor, and they lower that anchor to help them weather the storm. And then from there, I'll really describe to them, you know what, you also have an anchor. Normally at this point, they're like, no, I don't. They're kind of listening, right? And I'll, put my hand on my heart or my belly, or, depending if I'm standing or sitting, maybe both. And I'll say, your anchor is your breath. And then I'll just kind of sit in silence for a couple of breaths. And then depending on how they react or respond, maybe they'll have something to say. In my experience, most kids don't. And then I'll say something like, anytime you feel like that ship at sea, you can focus on your breath and remember that it's there for you, breathing in and out, being your anchor. right? And if your mind starts to run to this or that or the places that it likes to run, you can just return to your anchor breath. And usually after I've walked through that and spent about 5 minutes there, sometimes the kid spontaneously has things to say, or at least they're in a little bit more of a space where they're kind of ready to dig in to the bigger issues, a little more willing. Next slide, Christine. And just some important considerations if you think about incorporating some sort of breathing or grounding or almost mindfulness-like activity during your work. You always want to ask permission to teach. You always want to first ask about prior experiences with doing breathing exercises. Have they been good or bad? Sometimes people have had not so great experiences because they kind of get their mind to a calm place and then thoughts come flooding, right? And they're not ready for that. They don't want that. Another consideration is, especially with kids, don't focus on lengthening the inhale and getting a big, because sometimes that can kind of lead to that sensation that they're not getting enough air and can actually feel a little more biologically stressful. So if I'm noticing that while I'm doing anchor breathing, I might say to somebody, take a normal breath in and then kind of have a longer breath out, right? And I'll say, breathe in about this far and then breathe out even farther. I'll kind of show them that with my hands. And then always, always, always stop if any uncomfortable experiences arise and try something else or provide other supports or maybe see if a short break, then they'll be ready to continue. So these things are really, really good to use, but keeping these considerations in mind is also key. All right, I think that's the end of my section. All right, so I'm going to turn it over to Dr. Williams to take it from here.
Yeah, thank you. And again, welcome everyone. I'm glad that everyone could be here today. As we talk about the managing reactions module, which I think is one of the modules that we'll often use quite a lot when we're working with recent trauma survivors and folks who've recently experienced disasters. And one of the nice things that, again, I'll encourage folks, go back and look at the manual, because I think there are some really, really good tips in the manual that summarize some of the different coping skills that you're going to hear about today, including variants of the relaxation exercises that Dr. Hamburg just talked about. And I think it's good to have a lot of options sort of available at your disposal that you can use when helping work with folks to help people think about how to manage some of the intense distressing reactions that people might have in the aftermath of trauma or disaster. Because again, each of us are different, and the things that might help one of us cope might be different than how someone else might most effectively cope, right? So certainly relaxation skills are going to be very, very useful for folks. And I really appreciate, Dr. Hamburg, your example of the anchor breathing exercise and kind of walking us through that. I mean, that's one that I'll definitely tuck away and sort of use in some of my own work as well. So I appreciate you sort of walking us through that. And so relaxation skills, just helping folks sort of understand ways that they can utilize these skills when they start to experience sort of recurrences or heightened trauma-related distress just in day-to-day life, right? Can sort of help folks have a better sense that I know how to manage some of these reactions when they occur. But another really important skill that I want to spend a little bit of time talking about today, that's also covered in quite a bit of detail in the manual, is a very practical, I think, useful coping skill that can be really, really effective with the right person, is a writing exercise, something called just putting thoughts and feelings into words, is how it's described in the SPR manual. And for folks who are on the call and maybe are more familiar with actual trauma-focused treatments and interventions, right? So when we start treating things like PTSD or other kinds of trauma or stressor-related conditions with psychotherapy and behavioral health interventions, a lot of those interventions actually focus a lot more on kind of getting into the details about the trauma and things like that. And note that up to this point, we really haven't talked about doing a lot of that in the context of these early interventions, right? Because it's often not going to be indicated. But this particular exercise happens to actually, I think, sort of overlap a little more with some of the things that you might historically think of as us doing when we actually do trauma-focused treatment, right? And that this is a coping skill that actually invites folks to really spend a little bit of time engaging in activities that will help sort of promote emotional sort of processing of what you've gone through, right? So let's think a little bit about this activity, how you can sort of help people engage in these kind of therapeutic writing exercises that focus a little more on the circumstances and details surrounding the trauma or disaster and its impact on a person's life. And think about just sort of ways that you can do this, modifying it, tailoring it for both adults and youth, and sort of help folks most effectively use this kind of tool in just their day-to-day life. But why do we want to encourage folks, or some folks at least, to think about practicing writing about traumatic memories, right? What's helpful about that? And why is that a useful coping skill? Well, again, when we talk to folks about why this particular skill can be helpful, I'll just often sort of remind folks that writing about distressing memories or disturbing aspects of the trauma that continue to be experienced as intrusive, unwanted, unbidden, can sort of help survivors make sense out of their feelings and help reduce the intensity of strong emotions. And I think there's a variety of reasons why that can likely be the case. But for folks that already kind of have a natural inclination to write, maybe if you already actively journal or engage in other kinds of writing activities, just as something that you typically would enjoy doing in your own life, this is something that likely is going to be really, really helpful, right? And that it just gives folks an opportunity to really sit down and kind of help make sense out of what it is that they're likely experiencing. And I think that it's really important to do that for a whole host of reasons. So as Dr. Maris was talking about common reactions that people will experience, certainly those intrusive memories of what you went through at the time of the trauma or the disaster and what you went through in the aftermath of the trauma or disaster often are going to play out in a very real visual way and often come accompanied with really intense emotions for a lot of folks. But one thing about trauma memories that I think is particularly important to remember, right, is that when we experience memories of a traumatic event, sometimes those memories can be very fragmented, right? There are certain things that stand out very well, that are very clear, and then other pieces that maybe don't seem to necessarily fit well, that we have trouble sort of remembering or making sense out of. And all of those things together can make those memories particularly difficult to work through for folks. So taking time to actually sit down and kind of organize some of those disrupted, fragmented memories and all of the feelings that come with working through that can be really, really helpful for folks in sort of reorganizing kind of how we understand the meaning of events like this in our lives. So I think there's a lot of value in thinking about writing as a particularly useful coping skill for folks. And so when we think about it, there's often some instructions that I think are going to be really important to give people if you ask them to spend a little bit of time writing out memories about a trauma and sort of the thoughts and feelings that come with that, because I think that it's more than just writing about it, right? We want to give folks some parameters to make the writing activity as helpful and therapeutic as possible, right? Now the goal, again, SPR is not specifically a therapy per se, but we are still trying to help promote recovery and help give people skills to cope with what they've experienced. So what are some parameters that we can put around an activity like this to help make it most useful for folks, especially if we are now talking about activities that focus on trauma? So let's go to the next slide, and I'm going to go through a couple of slides here that go through some tips for things that you want to think about recommending to people if you encourage them to engage in this kind of activity. First thing that I try to encourage folks is try sitting down and writing without interruptions for at least 30 minutes. So if you decide to sit down and write about some memories of things that you've experienced, give yourself a good chunk of time to be able to do this. So we often encourage, write for at least 30 minutes. If you can write for longer than that, that's great, and that's certainly encouraged as well. Sometimes I'll even ask folks to maybe start doing a little writing activity in session with me, right? Just together, so we can sort of start the process of seeing what it's like. I'll kind of help give people some prompts to help get them started. But in encouraging them to do this outside of session with me, want folks to take a good chunk of time to do some of this and reserve some time to do this on their own. But I'm curious, for folks out there, why do you think we want people to do an activity like this for at least 30 minutes, right? I mean, sitting down and asking folks to spend that much time actually reflecting on and remembering some really painful things is a lot, but there's good reason for that. Why do we ask folks to spend a little bit of time with these kinds of memories? What do you think is essential to that? Curious if anyone has any ideas. Well, I'll tell you one reason that I think it's going to be really important here, right, is that we want people to spend enough time sort of reflecting on the things that they've experienced, so that they at least have a little bit of an opportunity for those painful emotions to come out, to be able to work with them effectively. And hopefully what we also see happen, and what often happens in the vast majority of cases, is that after a certain amount of time, the body sort of takes over and you start to see a natural reduction in the intensity of the feelings that are cued by remembering those painful experiences, right? And so what folks often sort of see is that when we sit down and start writing about painful memories and we experience the emotions that come with that, is that the emotions naturally start to dissipate and taper off over time, sometimes more quickly than we expected them to. And that can be particularly important for folks that maybe are engaging in a lot of behavioral or effortful kind of avoidance of things or activities that they might otherwise really want and need to do in their daily lives, but have been very reluctant to do out of concern that it'll just cue these unwanted memories and bring up all these painful experiences all over again. So I think that it's, for that reason alone, it's really important to make sure that we encourage folks to engage in an activity like this for at least 30 minutes, possibly more. And I also think it's important to encourage folks, start writing about whatever is most distressing to you. And that can mean a lot of different things, right? So sometimes folks may just find that there were certain elements of a trauma or disaster that were distressing. Maybe it was the aftermath, right? Not necessarily the event itself, but something that happened afterwards that really stands out to you, that you're having trouble making sense out of, that just seems to keep coming back to you all the time, right? Or it might be that right now, what's most distressing to you is just concern about what your day-to-day life looks like and concerns about what the future holds for you now that you've lived through these kinds of experiences. So I'm sort of talking about this as if, most people focus on, or if it's mostly indicated to focus on the trauma. And I think most people often prefer to focus on those painful traumatic memories, but that might not always be the case sometimes for everyone, right? And certain pieces of the trauma that folks might be more inclined to write about or focus on is going to differ from person to person. If a person is writing about the traumatic event itself, it's also helpful to just encourage people to include sensory information and sensory details. So Dr. Hambrick was talking a bit about some of that sensory information there. And so, I'll encourage folks in writing about these kinds of memories, write about what you saw or what you still see kind of playing out in your mind's eye. If there's something that does keep coming back to you all over and over again, write about things that you heard, write about things that you felt, write about the thoughts and the feelings that you were having at the time that the trauma was happening, or at least the thoughts and feelings that you're having right now, right? And I think including that kind of sensory information can really help sort of make those thoughts and feelings much more visceral for folks in some ways, and can sort of make them a little bit easier to work with in the moment, right? So there's a term in my field that we use, in just hot cognition, right? We want to make those thoughts and feelings hot enough that people sort of have the opportunity to then work with them, right? It's easier to it's easier to bend and sort of change them when they're hot enough that they're pliable, right? So we want to get folks to sort of include enough sensory detail that you actually can elicit the thoughts and feelings that are going to be important to process. So let's go to the next slide. I'll go just through a few other tips that I think are important to keep in mind here, particularly in the context of using this activity as a coping skill for an early intervention like SPR. I think it's also important to encourage folks, as you're writing about what you remember happening or whatever's most distressing to you, right, or what memories seem to be bothering you the most, try to think about things that you did to help others either during or immediately after the trauma, and also think about, whether others were there to help you, and if so, what did they do? And maybe include a little bit of time to just write about those aspects too, and to include some of that information in there. And I'm curious, again, just to kind of throw this out, why do folks think it's important to include these kind of prompts? Rather than just working through the details of the trauma itself and what you personally experienced, why do we want to include some instructions or some prompts to encourage folks to also think about what they did for others and what others did for them? Yeah, so yeah, and chat, social connection, right? I think that's one piece here, that just, having folks sort of think about who was there for them and what you did for others during that time can also help you think a bit differently about your own response, because sometimes some of the details about things that we did for others get lost. We may not remember certain things that we did. So that can change how we reflect on our own experience, but certainly it also helps speak to people who can be important social supports down the road, right? And sort of can help us think about others who were there for us that we might be able to count on again during really difficult times, right? So I think that it just helps, again, make that connection and sort of helps facilitate that kind of conversation. So certainly from a social support, social connection piece, that's an important prompt there. But one thing that I will also sort of talk about with folks is, hey, not everybody likes to write. Not everybody's naturally just enjoys writing or naturally does a lot of writing. And you don't just have to use writing as a medium to do this kind of activity. There are a lot of ways to do this. If you're not comfortable writing, I'll talk to folks and just, say we can do this verbally, right? Try speaking into a voice recorder and just recording it a bit, right? And documenting it that way. Go back, if you're not comfortable just sort of verbally describing it or recording it, use arts. I think expressive arts can be really, really helpful for folks. This kind of loops back around to writing, but sometimes we'll do things like, write a song, write, lyrics, write poetry, draw, use actual paintings, or crayons, markers, whatever you've got, draw something that sort of reflects what happens. And then just kind of use that as a means for promoting discussion. So I think there's a lot you can do here. Just get creative, work with folks where they are. And so, there are different interventions for actual trauma-related mental health problems that use each of these different versions. Sometimes we'll just ask people to describe things verbally. Sometimes we'll use arts to have people sort of, draw imagery for what they've done. So just be creative and see where folks are. And if we go to the next slide, with that, I think that's also particularly important to keep in mind when you're using this kind of activity with kids, and young children in particular. So I mentioned that trauma and traumatic memories are often experienced as really broken and fragmented for many folks. So one thing to sort of remember here is that when you're doing this kind of activity or suggesting this with really young folks, younger children are probably going to have a really hard time anyway remembering the order of events and the sequence of events in which things actually happened, either during or after a trauma. They may have difficulty identifying emotions. So, for that reason, it can be really, really helpful, I think, to just encourage kids in particular to draw pictures about what happened and then just sort of describe the details of what's going on in the picture and what their reactions to it are, more so than asking them to sort of identify personally and write about what was happening for them. But you can also, I think, when working with young kids, I think it's often encouraged, strongly encouraged when possible, engage a parent or a caregiver in this kind of activity so that they're there as a support while kids are engaging in these difficult, painful kinds of memories. So, one thing that you can do is, encourage a parent or a caregiver to play secretary, and they can write down for the young child or the kiddo what the thoughts and feelings and memories are as the child dictates it to the parent, right? So get folks involved, get parents involved in this kind of activity. And again, just be creative in how you kind of think about and approach this. Just as an example of how this can be particularly useful, if we go to the next slide, there's an example of a drawing here that was included in a paper that was published in 2019, and I put the reference on here for folks at the bottom. But this just shows you, what you can kind of do, I think, when doing this kind of activity with kids. And so this particular drawing was a drawing from a 5.5-year-old, I believe. And what's depicted here, right? You can't necessarily tell some of the details just because of the nature of the drawing itself. But what was described in the case example in the paper where this was published, the young child here is recounting a traumatic memory. And you can kind of see a little bit over here on the left-hand side of the drawing, what appears to be some stairs. And according to the author in the paper, the young child was working with the provider at the time, describing as they were drawing memories of having been pushed down the stairs by a parent. And so you can see sort of in the picture here, partly at the bottom, there's an image of the child who's drawing himself there laying at the bottom of the stairs, but was describing to the provider how it felt and what was going on for him at the time. So, I think using these kinds of visual cues to help create conditions where therapeutic conversation about what happened, what it was like for you, and how we can work with this and manage this now can be a really useful vehicle, particularly for young folks. Although I do also think that for adults as well, sometimes drawing or using visual arts can be really, really useful, just because it sort of taps into thoughts and feelings in a way maybe that language sort of buffers against. I think when we sort of can just get to the visual level, we can kind of bypass some of that higher order thinking that sometimes can leave us feeling a little more detached from the affect, emotions, and thoughts that are connected to these kinds of painful memories. But this is just an example of sort of, one way, again, how you can do this when you're working with folks. And again, I think it can be a particularly useful and really powerful tool. But that being said, I mentioned that, this is not a skill that we would recommend for everyone, right? We don't necessarily want to encourage everybody to do this. So who is this kind of skill going to be really useful for? Whether you are using writing or drawing or whatever you do. I think one important consideration, again, is the person, in terms of the distress that they are reporting to you, is the person experiencing a lot of really intense mental imagery. So some of those re-experiencing symptoms, if we want to use a term that's commonly used in the post-traumatic stress literature. Am I having a lot of intrusive memories of things that happened at the time of the trauma? And if that's the case, or folks are having recurrent nightmares about what happened, or you're finding that, little things that you see in the world around you just, are constantly sort of making you feel really distressed and upset whenever they remind you about what happened. For folks experiencing those kinds of reactions, this can be a really, really useful tool, again, in just helping people kind of work through some of the emotions and thoughts connected to those memories. But that being said, who is this not appropriate for? Because I think that's also important for us as providers to be mindful of. So if we go to the next slide, just some things to sort of consider is that the writing task, whether drawing, writing, anything that involves just different versions of this putting thoughts and feelings into words activity, is probably not going to be appropriate for folks who are unable to manage the distress that comes with writing about these kinds of experiences. Because certainly initially writing about these kinds of memories, when we sit down and first start to do it, it's going to bring all the associated thoughts and feelings up with it, right? So this presumes that folks are generally at a place where we already kind of have some basic skills just to help promote resilience and to help us sort of regulate strong emotion when it starts to come up. So if you sense that a person does not have the ability to manage that distress, right? Or you're not sure and just something tells you in your gut, like, I don't know, I'm a little bit concerned about whether or not that might be the case. Just keep that in mind, right? Because there are a whole host of other coping skills that you can use with folks, other than just this kind of activity. But I think it's also sort of just important to keep in mind that this sort of activity, where you're really focusing in on traumatic memories and encouraging folks to engage with those kinds of memories, might not be appropriate for folks in situations where someone's experiencing a lot of extreme guilt about an action that might have caused harm to another person. So I think that in particular, the developers of this model have suggested, just cautioned against, using this kind of skill in those kinds of cases. And of course, if folks are actively suicidal or have a history of psychosis, this might not necessarily be the most appropriate intervention as well. So this is really going to be, again, most useful for folks having a lot of recurrent intrusive imagery, but where we sense that, by and large, folks kind of have the conditions and resources, external and internal, to be able to work effectively with these kinds of memories. Okay, so that's just kind of a general overview of how we would do the more trauma-focused kind of element of the managing reactions module, right? But what questions do folks have about that before I wrap up this section and we get ready to take a break? Do folks have any questions at all about just the writing, putting thoughts and feelings into words activity? If you think of any over break, again, feel free to come back and ask, okay? Happy to answer any questions folks might have about that. But let's kind of package this all together. So how do we take everything that we've talked about so far and just kind of put it all together for the purposes of what it looks like in this module? So if we go to the next slide, right, you've kind of gone through just an overall review of the kinds of things that, you can often talk with folks about to help them manage reactions, whether it's, information and education about the kinds of things that folks are likely going to experience, relaxation skills, putting thoughts and feelings into words kinds of activities, right? You kind of have a good sense of all those different things and the value of each of those different skills. But then kind of to wrap it all up, really what you want to do with this particular sort of skill is use what's called a managing reactions worksheet. There's actually a worksheet in the protocol that will guide you through this. And I think it's really helpful to write this down on the worksheet with folks and give it to them so they can take it with them when they leave. But on the worksheet, kind of the main steps that you really want to do is knowing what kinds of reactions you're having that are most distressing for you. Let's think about cues in the environment that are likely to bring those reactions up, right? Again, remember, these kinds of memories, these intrusions that people have are often just that, intrusive, and they seem to come out of the blue. But a lot of times there may be something that cues or triggers those reactions that we're not always aware of. So let's start by identifying those, right? And if we can identify what's going to cue a reaction, it can help them seem a little bit less unpredictable, right? And folks can start to feel like we have a little more control over them. Then, go through the skills that you think are going to be most helpful to helping people manage those reactions, whether it's writing, relaxation, any other kinds of things, right? Scheduling positive activities, self-care, right? Just making sure that you eat and sleep enough can be really, really important in helping manage these reactions. So pick a few skills that you think are going to be most helpful in managing anything that is brought up by any environmental cues. And then include parents and caregivers in developing these plans to ensure that children in particular can carry out the plan. Once I can anticipate what's going to cue my distress, I have this particular skill that I'm going to use here. How can parents, caregivers, or other people that are closely connected with the kiddo help them sort of use these skills when they need it the most, right? And so caregivers can be really important in that process. All right. So any questions before we dive in and take a break? I know we've covered a lot of stuff. We'll take a 5-minute break and let some of this just sort of digest and sit in and sink in a little bit. But I'll be here, so if folks have any questions, just feel free to put them in on the chat. Comments, feel free to put them in on the chat. And then when we come back here at the second half, we're going to talk a bit about just, application. What does this all look like and how can we think about putting this together in practice?
Hopefully everybody had a chance to take a short break. I know I recently became, an Apple Watch wearer, and they give you those recommendations to stand up. I was starting to get mine, so I stood up. So for these next few minutes, we're going to role play for you. So you don't actually have to role play this time. Joa, Dr. Williams, and I are going to role play, working through this process of identifying reactions and managing them in the context of a 9-year-old child. And we're going to try to throw in a couple of details that we think would be helpful for all of us to think through when we think through using this model, and particularly using this model in kind of the heartland, the Kansas, Missouri area, where there are a lot of people who are affiliated with religious organizations who may also have like PFA and SPR training, and kind of how to work through that in a way that's compatible with the model. So I'm going to pretend as if I'm an SPR trained member of a 9-year-old child's religious organization. And the 9-year-old was with a babysitter when his parents found out that his best friend, who was also a cousin of his, was critically injured in a bike accident, right? So is, currently hospitalized for injuries. And so the scene was kind of that when the parents returned from a night out, they informed the child what had happened to his cousin. So I, again, am an SPR trained member of this child's religious organization. And because of that training, and also because I'm kind of a trusted person within this family's sphere, I've been asked to provide some skills for psychological recovery to help the child manage some troubling reactions. So again, if we're using SPR, we're 2 to 6 weeks out. So we know that this has happened at least 2 weeks ago, and people are kind of starting to think, hey, I think the child is having a hard time. All right, so Joe has graciously said that he'll play the role of a 9-year-old. So we can all give kudos for his acting skills, I'm sure. So just to give you a sense here, I'm going to kind of first start by providing some psychoeducation and then move through this process from there. Gosh, what's your name? I'll just call you Joa, then I won't mess it up.
That's fine.
Hey, Joa, it's good to see you again. I know we met a week ago and kind of talked about what happened, that your cousin got really hurt and that they're in the hospital.
Yeah, no. Yeah, thanks for seeing me again, Dr. H. It's been like, I don't know. It's been a really hard week.
I'm sorry to hear that. And yeah, I heard that your cousin is still there, and
yeah,
you haven't been able to visit because of the coronavirus. And I know
I asked to go and they wouldn't. Yeah, they said I couldn't go. Which
yeah, they wouldn't let you go. Has anybody talked to you about why you weren't able to go?
Well, I mean, I think it's because of the virus, but
yeah, and because you're 9 and can't have access to the vaccine yet, they're just trying to be really, really careful right now. But I know that's just an extra thing that's hard about this right now.
Yeah, but like I'm worried about him and I want to make sure he's okay, and I don't know, I haven't been able to sleep that well.
You've been having trouble sleeping.
Yeah.
You know what? I'm really glad you shared that with me, because a couple of weeks ago when we met and we talked, or about a week ago, and we talked about stuff, that wasn't something that came up, but that's something that your parents had noticed too. So thank you for kind of being willing to talk about that. I want to spend a couple of minutes maybe just talking about why things like having trouble sleeping happen after something bad happens. And then I want to spend some time talking about what we might try and what we might do about that. How does that sound?
Yeah, I like it.
Sounds okay. All right. So when things happen that we don't expect, that might be sad or even scary sometimes, our body is ready to help us out. Actually, we have really, really cool bodies that have all of these cool capabilities. And when we need them, they're there for us. And when something bad or frightening happens, our heart starts to beat really fast so that if needed, we could run away really quickly. Have you ever run and kind of felt that it makes your heart beat a little bit faster?
Oh, definitely. Yeah. I'm like the fastest runner on my baseball team too.
You're the fastest
Yeah.
runner? I
Yeah.
didn't know that
But
either.
yeah, it definitely gets my, but I definitely
Okay, so
like
you've got
notice
a pretty good heart then. Your
Yeah.
heart knows what to
Yeah.
do, right?
Yeah.
Something
Yeah.
happens, it's like, oh, I'm ready. I'm ready to run.
Yeah.
Yeah, that's good. That's good. Have you ever tried to like fall asleep right after running a big race?
No, I don't think I could.
I don't think you could either. I don't think you could either because your body's sending all those signals that it needs to be awake and ready to go
Yeah.
to win
Yeah.
that big race, right?
Yeah.
Yeah, sometimes it can take like hours after a big race to get that heart rate down and the body kind of relaxed.
Oh yeah. No, definitely. It takes a long time. I can stay up super late too.
You can, okay, so that was already a superpower of yours
Yes,
with staying up.
very much.
Yeah. Okay. Okay. Well, that's good to know too, because sometimes the things that we have a hard time with when something bad happened, or sometimes things that have already been a little hard for us, and it just gets maybe a little bit harder after something happens, like somebody that you love getting really hurt.
Yeah.
Yeah.
Yeah. 'Cause
So, yeah, go ahead.
I'm just I guess I hadn't thought about that, but I have like noticed that my heart's been beating more sometimes when I like do try to lay down to sleep at night, but I'm just like I'm really worried about my cousin, and I do think a lot about him, and I just hope I want him to feel okay,
Right.
and I get nervous when I like think about that he might not, and so I don't know, I can't. So I
Are
noticed
there
that
any
too when
other
I'm trying
parts
to
of your
sleep.
body that feel a little funny when you try to go to sleep?
It's just hard to, I don't know, it just feels hard to relax.
Mm-hmm. Maybe you kind of feel like ready to go.
Yeah. Yeah.
To go at any time.
Yeah.
Yeah. I think that's a really common way that a lot of people feel after something bad happens, because when our hearts beat really fast, it means that all the blood in our body is going to our heart to tell us to go, 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 instead of going other places that might tell us it's okay to relax and calm down, right? Like, for example, when lots of blood runs to our stomach and it helps us digest our food, sometimes we start feeling a little tired. I don't know if you've ever eaten a big meal and all that blood goes to your stomach to kind of take care of that. And you're like, no, it kind of is easier to sit down and sit still.
Yeah.
Maybe not for you. Yeah. But kind of the point is that your experience with your cousin getting injured is really similar in your body to the experience of running a race. And so now our job is to try to figure out, how do we help tell your body that it's okay to go to sleep? Now, something that I know from what you told me last time was that your parents were actually gone the night that your cousin got hurt, and that you didn't even know your cousin had been hurt till they came home.
Yeah.
Where are your parents when you're trying to go to sleep?
Yeah, I mean, usually sometimes they're home. I mean, and sometimes like one of them will go out, but or sometimes, I guess occasionally they're out.
Are they in your room with you, or are they in another room of the house?
No, they're usually in another room.
Yeah. And I think that's another part that is kind of hard about going to sleep at night, is that typically lots of people sleep either in their own room or in a different room than where their parents sleep. And so I wonder how that moment of kind of saying goodnight to your parents feels. Do you feel better or worse when your parents leave the room?
Kind of in the middle, I guess. Like I don't
Middle?
feel like I usually feel good when they say goodnight.
Okay. All right. So you feel okay when they say goodnight. When do you start kind of noticing that heart beating then?
Well, it's kind of like after they leave, when I'm just like, it's after they leave, and then I just think about, yeah, just think about my cousin being in the hospital right now.
Mhm, mhm. Yeah, I
And
guess
that's
I'm
when
just
I'm
kind of
alone.
reminded of the fact that you found out that your cousin was hurt and sick at night. And it just makes me wonder,
Yeah.
it just makes me curious if that's a reason why nights can feel a little more energized, a little more like, I wonder if my body needs to be ready for something else bad that could happen.
Yeah, because I guess when I'm at school, like, I mean, I'm not, like, I think about him sometimes, like, but I don't know, we get busy doing other things, and I guess it's not as, it's like when at night things get quiet. Yeah, and it was at night
Yeah,
when
yeah.
they told me about what had happened.
You're totally right. And yeah, at school, there's so many other things to focus on. And at night, it's like the only thing to focus on is sleep. And sleep can be pretty hard. Yeah.
Yeah,
Would you
sleep's
be
hard work.
would you be interested in learning some ways to try to get some sleep?
Yeah, I'm like, yeah. Let's learn some stuff.
All right, cool. Well, you know what? You've already done a lot of the hard work.
I have.
You have already done a lot of the hard work. You have already gone through the work of noticing when and why your body feels that beating heart. And so now tonight, if that happens, you feel that heartbeat, you feel a little bit like you can't sleep. It might not come as a surprise. You might actually expect it. And sometimes even being able to expect something gives us just a little bit of control over it. Right? When things surprise us, sometimes we don't really have a plan. But if we're maybe expecting something, we've already done part of the work to getting a plan in place. So when you're trying to sleep, you said sometimes you'll think about your cousin and the fact that he got hurt. What are some good things going on in your life that might be more relaxing or just kind of so to think about while you're trying to go to sleep? If you notice your thoughts moving over toward your cousin, which we know makes your heart beat fast and which we know makes it hard to sleep.
Some like fun things to think about.
Yeah, fun or yeah.
Mm. Well, I did make it to a new level on this game that I've been like playing really like playing a lot lately, and that's been pretty cool. And so like now I know kind of how to like get there, and that makes me that's relaxing to think about.
That relaxes you. Okay, doesn't make you too
Yeah.
excited because that new level sounds pretty exciting to me. I wonder if even that might make your heart start going fast.
Maybe.
I don't know.
Maybe, but
Maybe.
that's a good kind of fast.
That's a good kind of fast. Okay. All right. So we've got this game to think about. I like that. Let's keep that in mind. What's something else you could think about that maybe is kind of just so like I wonder if there's any music you like to listen to, or I wonder if there was something that your mom or dad ever did, like gave you a big hug or told you good job for doing something that might be nice just to think about.
Oh yeah, like a couple of weeks ago when I hit this home run was great. Like I definitely got that was an awesome day. I know my mom and dad were super proud that day. That was a lot of fun. But that feels exciting too. So I don't know. Like
Yeah.
my mom and dad tell me sometimes too. And I know, our pastors told me sometimes too, like to, pray, and that can help calm me down.
You know what? That's such a great point. And I was gonna ask about that. Is there anything from what you've learned through your religion that in the past has helped you sleep? And it sounds like prayer has helped you. Yeah. So we've got some ideas. We can
And my
think
dog,
about
my dog helps too.
your dog helps too. Does your dog like to be petted?
Yes.
That could be a really relaxing thing. Has your dog been sleeping in your room since your cousin got injured?
Yeah, she usually does.
She usually does. Okay, good. All right. So you've got access to your dog. So we've got 4 different ideas that we could try when sleep comes tonight, when it's time to sleep. We could try to think about the game. We could try to think about the home run. You see if it works. I don't know. Maybe that'll keep your heart rate up. Maybe it'll be really fun to think about. We don't know until we try it. Then we've got this idea to say some prayers, and we've got this idea to pat your dog. And I would try to do that anytime a thought comes in about your cousin, because you know, your cousin's in the hospital being taken care of right now, even though you can't see him. And at night, it's not like you'd be able to get up and go see him. And actually, the best thing you can do at night is to try to get some good sleep so that the next day, maybe you'd have the energy to call him on the phone or do a FaceTime or something like that. Okay. How do you feel about just trying out some of those 4 things tonight when you have trouble sleeping?
Yeah, I can try that.
Yeah. And make sure you try them all. If one doesn't work, try the next one. And if none of them work, just give yourself a pat on the back and say, I'll go back and see Dr. Aaron another time, see if we can come up with something new.
Okay, I can do that.
All right. Awesome. Good job, Joa. Thank you. So thoughts or reactions to this managing reactions section? Thank you. I told Joe if things don't work out at the university, we can maybe try some theater.
Erin, can you and maybe with Joa talk a little bit about kind of your thinking around the spiritual aspect? And I think somebody just made a comment about that, of like where, like just how you think about that, right? So you brought it up that, you know, you're this trusted adult in this 9-year-old sphere. That's why you were invited in, right? And then Joe was actually the one who brought prayer up. But like maybe just kind of talk about that a little bit.
Yeah. I mean, you know, I feel like this type of thing can easily get into a gray area, but I'll share some of my thinking about it and then let Joa chime in as well. I think that often people who are interested in helping with disaster response, people who are invited by families to help in times of disaster and trauma, are either themselves have some sort of religious affiliation and or share one with the family. And I think when the affiliation is shared, you still want to be really careful and allow the child and the person maybe space to bring in the way that faith or spirituality or religiosity helps them cope, and encourage any connection with that the child or survivor looks on positively, right? So let's say you're not religious at all, but somebody has brought forward that a religiously oriented coping strategy is very helpful to them in times of stress and need. It is in line with SPR recommendations to encourage continued connection with that, whether or not you share a faith background. Mm-hmm. And in fact, during your information gathering, if you become aware that some sort of spiritual body is useful to a person, bringing it up yourself and asking if or how it could be useful in this instance is also always in line. And Joe and I were kind of talking back and forth, like, how does it change, or does it change if you actually share that religious background? You're actually maybe even from the same group. it really might not change that much, except that the topic is probably more likely to be broached and discussed openly, right? Because it's just kind of assumed and known that there is this shared background. I don't know if Joey, you have anything you want to add to that?
No, I think that you hit on all the main points there. One other piece that I would sort of
Shared faith.
add to that, I guess, is that where I think folks trained in SPR who come from a spiritual counseling or a pastoral counseling background, or have a background in chaplaincy or other other religious or spiritual training, especially higher level spiritual or religious sort of training. When you're working with someone that is from your particular faith community or that shares your beliefs, I think where that can be particularly useful and something like SPR is to draw on sort of shared stories, narratives, and the examples and the metaphors that you use to help people understand ideas, and I think that's one place where if folks share a similar background and share a similar faith tradition or religious tradition in particular, drawing on just shared stories to highlight ideas and concepts can be important, as well as just being knowledgeable that certain practices, right, might also be in and of themselves valuable coping skills for folks. And to just echo what Aaron said, if you do not come from that tradition, or don't share a particular faith tradition with someone that you're working with, I still, if it comes up in the context of conversation, if someone brings up the importance of prayer or something else from their faith tradition that's important to them that I haven't otherwise asked about, then by all means I'll talk about that, and let's think about how you can draw on that strength right now as something that you can use to help you manage reactions. And I think it's important for us to be thoughtful and mindful about that. I'm thinking about times where in the work that we've done, I've talked about some of our hospital-based work here in Kansas City where we use SPR, and it's certainly at times when I've worked with folks, it's fairly common that folks will describe prayer as something that's really helpful for them, particularly in the context of acute injuries where you're still hospitalized. And so I hear that from folks a lot. Sometimes when folks talk about praying as something that really helps them whenever they start to feel really distressed, if folks mention that there's a specific prayer that they've used or that they find particularly helpful, I'll ask them if they're willing to share it with me, and just so that I can hear it. And I want to so we can experience that together, so I know what that's like, just to kind of help them again draw on the strength that gives them. So I think just be open to understanding what is going to be most valuable for each person, and if you have shared traditions, use those traditions to highlight the concepts that we're talking about here today and help folks, help make them more resonant for folks. And I think you did a great job, Aaron, too, just in going through how you used personally relevant examples for this child, right? Of things that were important to him. And in some ways, faith leaders are at an advantage when it comes to using the narratives and the histories of those traditions to help highlight those examples for folks, as well. So.
And I would also say, in terms of developmental considerations, if you have a bit of a dual role, right? Like it was clear in this narrative that like I was the preferred person, right? Like not only do I have SPR, but I have this shared background, belief system, and but still clarifying with caregivers, like what are you hoping for here? And what are some of the goals in terms of how you would like me to include anything relevant to our faith, and also I think describing the intervention it can be helpful too, because maybe the family wants me because they really just want somebody to meet with their child to pray, and they don't really understand SPR. And when the kid comes home with a variety of strategies to go to sleep, right? So I think really just being transparent and setting up expectations can help.
Yeah, I appreciate your all's responses there. I think it's Joe, when you were talking about kind of the idea of if the survivor has a particular prayer and delving into kind of more of the details, so then that can become part of the plan.
Yeah.
It makes me think of, what if there's a person has a mantra or a scene that they imagine that's really relaxing or something else, and that kind of your goal there is to get really specific into the details, so that then you can help the person, figure out kind of how to get there, or how to practice, or those sort of things. And also how, how different the dynamic might have been, Erin, you were saying kind of with this dual role,
Yeah.
and not knowing, and kind of what the parents' expectations were, but how different it would have been if Joa had said, my parents told me to pray, and that I can pray and help my cousin feel better. Do you think I should pray?
Right.
And
or that hasn't worked.
Right. Or that hasn't worked. Or what do you think I should do? Right. Which would be kind of that flag of, oh, there's a power dynamic thing happening here. And this might be a space where, not that you have to take it off the table if the person's putting it on the table, but just to kind of step more lightly around it.
No, great. Thanks everybody for weighing in during that. So we hadn't done a role play before. We didn't know how long it would take. I think that we'll probably forgo our breakout rooms today and maybe make up for that in our fourth and final session next time. And so what I'd like to do now is invite any final thoughts or questions that people might have before moving on to our word cloud exercise. Just to kind of recap, today has been all about the skill of managing reactions. We're trying to help individuals, provide psychoeducation about common reactions, help people identify the reactions they're having, and then get a plan in place. Again, we are skills focused. We're not just going to process things with people and then leave it. This is a skills focused intervention. So make sure you have time to get to all of that. And I saw a question in here would love to hear ideas about this sort of interaction when the child is more dysregulated. I think the interaction would look way longer. I think the interaction would have been way less verbal, right? We would have gotten the ball out and tossed it around. And I don't think I would have done quite that much planning. I think even coming up with one little tiny thing that they might be willing to do, and I'd be like, this was a big, huge win. Or maybe even to just juxtapose what I just said, maybe I would keep the meeting really, really short, or, work for 5 minutes and then kind of say, hey, go play on the church playground for a while, and I'll come back in 30 minutes and maybe we'll talk about another little piece of it. And then we'll go just eat a snack. We'll have a snack together, and then maybe we'll do just 5 more minutes, right? So really thinking about how can I just bite this off in little bits, and as soon as I start to see kind of that agitation, give them a space to move and to have a break from it, but still as possible ending with some sort of skills focused plan that can be a focal point for that individual moving forward.
Erin, I really like that in terms of cutting it up sort of like into pieces, so chunking it out. And even when this friend posted this question, I was kind of thinking it through and thinking, well, I think the first task would probably be to help them get regulated, right? So that they could calm down, just so that their brains, could retain the knowledge. But as you were talking about it and sort of chunking it into pieces, that would also give you lots of opportunities to check for understanding, for retention, that could help kind of, help you assess how dysregulated they are. So are they so dysregulated that they're not remembering anything that you talked about? Like, is there, and that would help you sort of, again, sort of change where the bar is on that. So I liked that problem solving.
Well, and again, think about, is this skills focused intervention where we are, right? Or am I getting signs that, wow, if they're like this around me, I wonder how things are going at home and at school, and if we need a higher level of support. Right. All right. We can move on to the word cloud.
Okay, so as we close out today's session, we would love for you all to join us in participating in another word cloud. So Chrissy or someone is going to post the link in the chat. You're going to click the link in the chat, and the prompt for today's word cloud is, what stress management strategy resonated with you? So a stress management strategy, a coping strategy, any of the kind of skills that we talked through today. So Polly in the chat is saying the anchor breathing. Yeah, absolutely. Thank you, Polly. I actually messaged Aaron after that and said, well, I feel really grounded now. I hope it worked with other people too. Also from Lynn, the anchor breathing. Okay, and anchor breathing also absolutely showing up in our word cloud. Lots of praise for Erin and her relaxing anchor breathing activity, which I loved. I love that picture. Even just looking at the picture just helped me feel sort of calm. So we also have slowing down, which is a great strategy. The free writing, so what Joa covered, this idea of being creative. And so really, kind of thinking out of the box, working with what you have and what the person is bringing. Reaffirm the dog petting. Love that one too. Any other final comments in here in terms of strategies? Okay, well, thank you all for, and Erin, I selfishly want to note that I will be out next week, and that, so Erin, yes, unfortunately will not be able to join us next week for our fourth and final session. So Erin, thank you so much for everything you have done to facilitate and contribute to our learning in this process. We will miss you next week, but we will send good, calm, anchored breath thoughts your way. Just a couple more that got in here on the word cloud in terms of stress management strategies, art, emotions, just recognizing. And I think the recognizing might have been connected to something else perhaps, but also just kind of recognizing where a person is, recognizing someone else's, the survivor's strengths. But absolutely, lots of positive reinforcement for the anchor breathing and those kinds of strategies. One thing just to note about the anchor breathing, and I think I just modeled it here, but in working with schools and working with a lot of grown-ups who work with young people, one of the things that I feel like we often try to emphasize, and Erin illustrated it beautifully here, is that the same strategies that we use with young people can be adapted and used with adults. These kinds of strategies that we use with adults can be adapted for young people and people of all ages. It really is just in terms of thinking about the words we use, the images we use, and just making it relevant and developmentally appropriate. So I think that's one of the benefits as adults in these situations, is that we're oftentimes working with young people to help them learn these skills. But when we participate too, it's great self-care in terms of making sure that we ourselves are grounded and being mindful and calm, and sort of the reminder here in our word cloud, slowing down. right? That sometimes just slowing down and breathing can be a great intervention. Erin, Joa, any final words before we wrap up our session today?
No, thanks everybody for your participation, and be in touch.
Same.
Fantastic.
I look forward to seeing everyone next week. Thank you all again for your continued engagement, and we look forward to wrapping everything up next week. So thank you, everybody.